Okay, I'm doing my speech on CHARS syndrome. Imagine being pregnant or preparing to be pregnant for the first time and going into the delivery room feeling anxious or nervous. You're excited to meet your little one, expecting for a perfect, healthy baby, and you're minutes, literally minutes away from giving birth or preparing or, meeting your new little one for the very first time. All you hear is one more push. 3, 2, 1, push. Baby comes out. Baby looks healthy. Baby is not crying though. You don't hear anything. And panic starts setting in. Worry starts setting in. And the team, a bunch of nurses start running in and they're just reassuring you. Your baby is fine. Your baby is normal. Your baby is healthy. Your baby is just having some difficulty breathing. So they rush your baby to the NICU, where your baby is struggling to fight and for it to breathe on its own. This happened to me and my first newborn baby, and it happens to be CHARS syndrome. So most babies that have CHARS syndrome are not diagnosed until they are born, and even once a DNA is tested, they only have a 60% accuracy rate. My son, he was rushed to the NICU. He had troubles breathing. He also wasn't diagnosed with CHARS syndrome until he was 6 months old. We had no idea that he was going to be born with this syndrome. CHARS syndrome is a rare genetic disorder that may go undiagnosed or get a false reading on a DNA test. CHARS syndrome is a very complex disorder that involves a lot of medical and physical difficulties throughout their life. 1 in every 9 to 10,000 births worldwide will have a CHARS syndrome baby. Usually there are no past family histories of CHARS syndrome. Most babies born will have life-threatening defects such as a heart defect, or they will have breathing and swallowing difficulties. Most babies pass before the age of 5 due to all their severe medical difficulties, and if they do live past the age of 5, the life expectancy rate is unknown. The cause of CHARS syndrome is unknown as well. It's basically playing Russian roulette. You're just not sure what's going to happen. The chances of this happening again is going to be 1 to 2%. So it's very little that this will ever happen again if you guys have a CHARS syndrome baby. CHARS syndrome is an acronym, and the acronym is C is for coloboma of eyes, H is for heart defect, A is arteria of the choane, which is a blockage in the airway, in the nose, it could be, or anything like that. R is retardation of growth and development. Most babies born with CHARS are really small. My son happened to be in newborn clothes until he was 7 months old. So if you can imagine a 6-pound 7-month-old, they're really small. G is genital and urinary disorders. E is ear abnormalities and deafness. There are many, many other characteristics, such as low muscle tone. CHARS syndrome babies usually have a typical square face, and they also have a palm crease right in their palm. And that's one of the biggest ways to know if your child has CHARS is the palm crease, and if they look like they have CHARS, and they have a lot of the acronyms. CHARS syndrome has so many other characteristics that can affect other syndromes. It can look like DiGeorge syndrome, or it can look like Kabuki syndrome. So, with that, testing for CHARS syndrome can be very tricky sometimes. 2/3 of the DNA tests come back positive, the other come back negative. They call that a false negative if it doesn't come back. If you have all the symptoms and you have all the signs of CHARS syndrome, you can be clinically diagnosed. A geneticist is a good person to talk to if you want to be clinically diagnosed. you know, or get the DNA blood test. So that's really about it for testing. Most kids don't know they have CHARGE syndrome, or the parents don't know their kids have CHARGE syndrome until they are older. CHARGE syndrome kids have a very hard life. They require a lot of medical attention and therapies for years. They tend to have behaviors that go along with their complex medical issues like OCD, ADHD. The earlier they receive therapies and medical treatments, the better off they're going to be. Once they hit adulthood, their life expectancy is unknown. CHARGE syndrome, again, is a rare genetic disorder with many that go undiagnosed or get a false reading on a genetic test. So, in conclusion, just remember that the traits of CHARGE syndrome stands. Remember what this traits for the character. Oh my gosh! Remember what the. In conclusion, remember the traits of what CHARGE stands for. And if you think your child has it, don't be afraid to go get them looked at or tested for. Or this is a rare syndrome as well, but it could also be life-saving.